Dear students, today we want to know why coronary blood flow decreases in massive pericardial effusion. Before understanding the pathophysiology, if we want to see the arterial supply of the heart, we'll see that the heart is supplied by right and left coronary artery. So this is the left coronary artery and this is the right coronary artery, and they originate from the root of the aorta behind right and left cusps of aortic valve respectively. So the coronary arteries, they take origin from the root of the ascending aorta. Now the right coronary artery, it principally supplies the right ventricle and the right atrium, and the left coronary artery supplies the left ventricle and the left atrium, and physiologically there are no anastomosis between the right and left coronary arteries, and thus the coronary arteries are the end arteries in human beings. As the territories of blood supply by these arteries, they do not overlap. Now, coronary circulation has some special features. One of the important features is that the left ventricle, it gets the maximum supply of blood during the time of diastole. Why? Because if we look into the pressure of the left ventricle and the aorta, during the time of systole, obviously the ventricle is contracting and blood is moving from the ventricle into the aorta. So the ventricular pressure, it must be greater than the pressure of the aorta. In this graph, we can see that during the time of systole, the aortic pressure is 120 millimeter of mercury, whereas left ventricular pressure is 121. It is greater than the aortic pressure. Now, we know that coronary arteries, they take origin from the root of the ascending aorta. So, aortic pressure, if it is less than the ventricle, then we know that blood usually flows from high pressure to low pressure. So, but aorta is at the low pressure than the ventricle. So, the flow from the aorta to the ventricle, left ventricle, it will be hampered. But this is not in case of right ventricle. In case of right ventricle, the aortic pressure, the right ventricular pressure is 24. The pressure gradient is maintained. Okay, so right ventricle gets some blood, but in case of right ventricle, during the time of systole, we can see that the aortic pressure is lesser than the left ventricular pressure. So the movement of blood is hindered. Another important feature is that the heart is a muscle. Like skeletal muscle, when it contracts, it compresses the blood vessels within it. Okay. So when during the time of systole, the left ventricle is contracting, so inside the layers of the muscle, the coronary blood vessels, they are also compressed. So during the time of systole, we can see the blood vessels are compressed, so the blood flow through them, it is diminished. In case of diastole, we can see that when the ventricle is relaxing and the aortic pressure is during the time of diastole, it is 80, whereas left ventricular pressure is less. Okay, so there is a pressure gradient, high pressure at the aorta, low pressure at the ventricle, and the ventricular blood vessels, they are not compressed, they are dilated. So we will see that during the time of diastole, the left ventricular blood flow is enormously increased. It is actually the time of diastole when the left ventricle gets blood. Now you can see here from this graph, it is very clear. During the time of diastole, the left ventricular blood flow, it is very high. Okay. So as coronary blood flow in the left ventricle, it increases during diastole. So any factor that shortens the diastole, it may be tachycardia. If the heart rate is increased, obviously the duration of diastole will be less. It may be the diminished left ventricular blood supply or diminished diastolic filling. They will all reduce the coronary blood flow. So anything that will cause or shortens the diastole, that will hamper the blood flow to the left ventricle. Now we will see what is happening in case of pericardial effusion. Now in pericardial effusion, there will be accumulation of fluid, or fluid accumulates in excess in the pericardial cavity. We can see that here. So fluid is accumulated in excess in the pericardial cavity, at which increases the intra-pericardial pressure. So it will increase the intra-pericardial pressure, and that prevents the ventricular expansion. So pericardial effusion means the accumulation of excess fluid in the pericardial cavity, and that will increase the intrapericardial pressure, which will prevent the expansion of the ventricle during the time of diastole. Here we can see that the expansion of the left ventricle is prevented. It is narrow. So the diastolic feeling is hampered. So in massive pericardial effusion or in cardiac tamponade, the expansion of heart is severely restricted due to the compression of ventricles from the pericardial sac. So it is giving a pressure on the heart, and the expansion of the heart, it is restricted, or the diastolic feeling will be grossly reduced as a result of that. So as the ventricular cavity, it will accommodate less amount of blood, so obviously the cardiac output will be less. Okay, so this accumulated fluid in the pericardial cavity, it will cause the myocardial compression also, reducing the coronary blood flow and oxygen delivery to the heart muscle. And we know that anything that will shorten the diastole, that will reduce the diastolic feeling, will affect the coronary blood flow. And these pericardial effusion also cause a reduced coronary perfusion pressure. So the increased pericardial pressure, it can decrease the pressure gradient across the coronary arteries, and it will also reduce the coronary blood flow. Okay, so diastolic feeling will be hampered in case of cardiac tamponade or pericardial effusion. So there will be, as the expansion of the heart is grossly affected, so diastolic feeling will be less, the cardiac output will be less, and there will be myocardial compression, and coronary perfusion pressure, it will be reduced. The pressure gradient, it will be reduced, so the coronary blood flow will be severely compromised in case of pericardial effusion. So this is the reference. Thank you.